If you have lymphedema and are working on your home management program, then you know self-bandaging is an integral part of this program. My goal for today is not only to show you how you can self-bandage either your arm or your leg, but also to give you some tips and tricks to make self-bandaging manageable. Because trust me, there is a learning curve. You will have bandages roll across the room at least once, if not more than that, during this learning curve. And it can be the cause of many frustrations and many attempts to give up on your home management program. But stay tuned, and I promise you will be able to do this on your own with time. My name is Lisa Sylvestri. I'm a physical therapist and a certified lymphedema therapist, and my goal is to make us all lymph smart. I have 3 plus 2, so 5 tips and tricks to make self-bandaging a breeze, or at least closer to a breeze than it's been in the past. My first and probably the most important trick I offer is to just splay your fingers, splay your toes, or widen your hand or foot as far as you can at the onset of bandaging. Because bandaging starts here and moves up, or starts at the foot and moves up. One of the biggest complaints patients tell me is that they just can't do it because their hand or their foot is bandaged too tightly and it's crunching the bones, causing a lot of pain and discomfort, leading them to take those bandages off sooner than they should. So splaying and stretching out the hand and foot, and I'll show you how to do that, is trick number 1. Trick number 2 is to pull the bandage evenly and equally each half turn around the limb. So whether it's the arm or the leg, you want to make sure you get an even pull to get even compression up the entirety of the limb. And the third trick to remember is to bend your limb, so your elbow or your knee, just a little bit. This will significantly increase your comfort while wearing the bandages. If you try and bandage your arm with your elbow locked out, or try and bandage your leg with your knee locked out, it's just so much more uncomfortable than starting with a nice gentle bend of either the elbow or the knee while you're bandaging. So those are my 3 top tricks, but 2 bonus tips that I offer. Weight bear through your limbs. So sometimes it's easier and you get a better result if you stand and weight bear through your leg, or if you lean and weight bear through your arm while you're performing. I will show you an example in just a moment, but keep that in mind. And the final trick, again, it's an easy one. As you're bandaging, the closer you keep the bandage to your limb, the easier it will be to get up. Versus if you give yourself a lot of bandage and a lot of slack, it's so much harder and things get twisted and it can become a mess to bandage. So stay tuned while I show you the easiest way for you to self-bandage an arm and a leg without too much physical and mental anguish. And I promise you'll be able to do this in no time with practice for your long-term self-lymphedema management. Here are just a few more thoughts before we get started in the instruction on self-bandaging for the arm and the leg. Do not worry. Perfection is not the goal. Progress and improvement each time you attempt to self-bandage is the goal. I can almost guarantee your bandages will not look like mine nor your therapist the first time, maybe even the second or third time. But the more you do it, the easier it will get and the more effective your bandage will get. After you take your bandages off for the first time, inspect your leg. Make sure that there are no red spots, no tourniquets, no irritations, no lumps or bumps or things that you've actually created with your bandages. We're looking for progress. If you have an area that's too small or too tight, you may need to make your foam more cylindrical. If you put the bandages on and 10 minutes later you can't feel your fingers or your toes, you've pulled too hard. If 10 minutes after it's been on, the whole thing falls out underneath your clothes, you didn't pull enough. You will figure out how to do it. I recommend having 2 sets of bandages so that when you remove one, you can simply throw it in the wash and have the second set ready. If you only have 1 set, you can probably get 2 bandage wears out of it prior to it needing being washed. After that, the bandages will lose their shape if they're not taken care of properly. Bandages, just like compression garments, can be washed and dried in the gentle cycle of your washing machine without fabric softener. If you do put it on the dryer, put it in the gentle cycle for just about 10 minutes, then unroll them and hang them over the shower overnight to fully dry. The 3 things I tell every patient to look out for after they have been bandaged is you don't want bandages to cause pain. Now, if you have pain and discomfort prior to bandaging, the bandages should not create any more pain or any new pain. If your pain is the same before bandages as it is after bandages, hopefully as the size goes down, that will improve. No new pain, no numbness and tingling. We all sometimes find ourselves in positions where our arm or our leg falls asleep and we can usually shake it out. If you cannot get up, move around, shake it out after 2 or 3 minutes, it's too tight, take everything off. Lastly, if you feel any discomfort, chafing, rubbing, irritation, take everything off and start over. You do not want to create blisters underneath your bandages. If you cannot wear them comfortably, you will have to figure out another alternative. If you're doing self-bandaging for the first time and everything feels good for 3 or 4 hours and then starts to feel uncomfortable, take everything off and slowly increase your wear time to 8 hours, 12 hours, 24 hours. After usually 48 hours, sometimes patients get a 3rd day or 72 hours of wear out of one bandage. It is absolutely time to take everything off and start fresh, start new. You never know what's happening on the under layers of the bandages. As you start losing circumference or losing size in the limb, things may shift a little bit underneath. If they shift, you're more prone to get some sort of tourniquet effect. So 2 is usually the max days, sometimes 3 if you're trying to last all weekend and you're not doing too many crazy activities or using the arm or leg too much and it stays in good shape. No more than 3 days. My final word of advice here is do not attempt to use ACE bandages to wrap a limb with lymphedema. They are not appropriate. If you have not watched my video on why short stretch bandages must be used for lymphedema bandaging, you must check it out in the link below. Okay, let's get bandaging.